Hi everyone and welcome back, or welcome if this is your first time here. I'm David Mock, a licensed health insurance broker. I don't work for the US government or the federal Medicare program. I'm licensed in New York and Florida, and I help individuals in those states understand their Medicare options so they can choose coverage that fits their needs. Today, we're breaking down the different parts of Medicare, one of the most confusing topics, but by the end of this video, it will make a lot more sense. Medicare is health insurance for people 65 or older. Some people qualify earlier if they have a disability, end-stage renal disease or ALS, also known as Lou Gehrig disease. Medicare isn't one single plan. It's made up of different parts, and understanding those parts is key to choosing the right coverage. Let's start with Part A, which is hospital insurance. Part A helps cover inpatient hospital stays, skilled nursing facility care, hospice care, and certain home health services. Most people don't pay a monthly premium for Part A if they or their spouse worked and paid Medicare taxes long enough. But that doesn't mean there's no cost. There are deductibles and other out-of-pocket expenses. Next is Part B, which is medical insurance. Part B covers things like doctor visit, outpatient care, home health care, durable medical equipment such as wheelchairs, walkers, and hospital beds, and many preventative services like screenings, vaccines, and your annual wellness visit. Part B does have a monthly premium and generally covers about 80% of approved services, which means you're responsible for the remaining 20% unless you have additional coverage. Then we have Part D, which helps cover prescription drugs. You can get Part D by enrolling in a standalone Medicare drug plan alongside original Medicare or through a Medicare Advantage plan that includes drug coverage. These plans are offered by private insurance companies that follow Medicare rules, and costs and covered medications can vary, which is why reviewing your prescriptions is important. Now, let's talk about Medigap, also called Medicare Supplement Insurance. Medigap helps pay for costs original Medicare doesn't cover, like deductibles, co-pays, and co-insurance. These plans are standardized and labeled by letters such as Plan G or Plan K. The benefits for each letter plan are the same no matter which insurance company offers it. The main differences are prices and service. When you enroll in Medicare, you have two main ways to get your coverage. Original Medicare includes Part A and Part B. You can add a separate Part D drug plan and a Medigap plan to help with out-of-pocket costs. You can use any doctor or hospital that accepts Medicare anywhere in the US. The second option is Medicare Advantage, also called Part C. These are bundled plans that include Part A, Part B, and usually Part D. They're offered by private companies and often have networks, different costs, and sometimes extra benefits like dental, vision, or hearing. There's no one-size-fits-all answer. The right choice depends on your health needs, prescriptions, budget, and how you prefer to access care. That's where working with a licensed broker can help, to compare options and make sure your coverage fits your situation. If you're in New York or Florida and want help reviewing your Medicare options, you can click the link below to schedule an appointment to discuss your Medicare needs. Make sure to subscribe to the channel because next week I'll be doing a deeper dive into Part A and Part B, what they cost, what they cover, and common mistakes people make. Thanks for watching, and I'll see you in the next video.